Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
Welcome to Centerpoint. I'm your host, Dr. Ron Anbar. In this show, we will discuss ways that we can journey to our own centers. This can help us access our inner resources to improve our physical abilities and health, our mental strength, our emotional well-being, and our spirituality. And today we have a very special guest, a very good friend of mine, Dr. Joseph Zastrow, who I think I've known for 2 decades already. Somehow time flew. Hello, Joe. Welcome.
Hey, Ron. How's everything?
Everything is good out here in La Jolla, California. I gather you're somewhere in North Carolina today.
That's right, outside of Charlotte. We're on beautiful Lake Norman. We're about 2,800 miles apart on I-40.
There you go. Dr. Zastrow is a family practice physician. I met him through our association at the American Society of Clinical Hypnosis. He is a past president of that society. He went to medical school at the Medical College of Wisconsin, and he did residency in Charlotte, North Carolina, in family practice. And I gather now you're working in Richlands, North Carolina, with near the Marine base. So you're working with a lot of Marines and former Marines and retired Marines. So maybe you'll tell us some cool stories from there.
Yes, I'm over in Onslow County, which is where the Marine base, Camp Lejeune, is based. All of our Marines listening certainly will know where that is. And Richlands is a small town. A lot of Marines retire there, and so I have a lot of retired Marines, also Navy, and we have other folks, of course, and a lot of farmers, and it's just a nice little small town to practice in.
It sounds like a nice place. Sounds like is it relaxing, laid back?
Oh, definitely. Yeah, definitely. Well, it can still be very, very busy. Being the only medical doctor actually in town, there's some nurse practitioners and PAs, but being the only medical doctor for 30 minutes around, it certainly can be challenging at times, especially since we don't have a hospital right nearby. We've got multiple, but they're all at least a half an hour away.
So you get to use all of your skills there, which is, you have many
absolutely.
skills.
Yes, absolutely. Plus, we also have oncology that is embedded in the practice, as well as cardiology. And so I'll see some of the oncology patients for nausea, smoking cessation, and taking care of chronic pain.
And I assume you use hypnosis as part of that therapy.
Oh, yeah. Oh, yes. Yeah, exclusively. They take care of their patients, but they'll consult me and ask for help on those problems in particular.
Maybe we can back up. Tell us how you got involved in the world of hypnosis. What was your journey?
Well, my journey started when I was very young. My younger brother had a disease, some people may or may not know it, but it was for a better term, it's where the bones grow sideways in the epiphyseal plates. So they get these osteochondromas all over the body, and they have to be taken off at various times as the bones grow, and it's very painful. So every Christmas, Easter, as soon as he got out of school, he went to the orthopedic surgeon as he was growing up. And he couldn't tolerate the pain medicines, and he had actually had his wisdom teeth removed right before Christmas, and he was miserable. And my dad being a physician and my next-door neighbor, a PhD psychologist, he went over next door, talked to him, and he came over and he did this hypnosis stuff with my younger brother. And from then on, he just went through these operations, just rolling his eyes up and breathing and doing this hypnosis thing. So then when I went to medical school, I just thought we learned it in medical school. And I actually asked the dean of student affairs, I said, when are we going to learn hypnosis? And he looked at me and said, son, we don't teach you voodoo here. And I realized that there was certainly a disconnect right at that particular moment. So I spent the only elective that I had in my fourth year of medical school. I set it up for pain management with my next-door neighbor, who was a PhD psychologist doing pain management and using hypnosis. And so I spent a month with him in medical school, and I learned enough to know that I needed to learn more in order to really be able to do it well. And when I came to residency, we had a PhD psychologist, of course, in our faculty. I asked him, and he said, oh, I want to learn it. And he had been trained in some Ericksonian techniques. And I went to my chairman, and he said, wow, that's a great idea. I'd love to learn it, too. I just don't know where. And just never really had the time to do it. So it wasn't a voodoo in residency. It just never came around to fruition. And I started practice in Charlotte, and it was 3 hospitals every day, ICUs. I took care of one of the community ICUs, and I was the chief of the family practice department at Caroline's Medical Center for 5 years, and I was just way too busy. And I literally saw my daughter in the morning asleep, came back, saw her again asleep in bed when I got home, and I thought, I got to make a change. I got to do something else. So I was getting paid less being the owner of the practice, and I decided to do this thing, take a job, and let someone else take all my worries. So I worked for a hospital, and I asked them where they needed the most help, and they pointed to a small town in Davie County, North Carolina, I'd never even heard of. And they had a physician there for 45 years, and he had retired. They replaced him with a physician who wasn't working out at all, and they asked me to take over that practice. And it was about a 45-minute drive, and I said, well, that'd be all right. I'll do that for a year or two. Well, I got out there, and the first thing I decided was I'm going to learn hypnosis. I am going to do that this year, and that's what I'm going to do. And so I went out to Reno, Nevada, and for the annual meeting back in, I don't know, 2001, 2000. I don't remember. It was early 2000s. And I went to the meeting, and I felt like I was right at home with the people. It was like I knew people already there. It was like I, had been with them before. And they told me after the basic course, as soon as you get back, use it the first day. Well, I had to wait till the second day for it, but I was able to use hypnosis right away. And it was an interesting case. It was a case of a lady who her name's Mary. It's okay to use it. She was very happy when I presented this case before. And Mary was very frightened of needles, and she'd had a knee replacement a few years earlier, and it was so bad that everyone in the staff at the hospital knew her. She was a horrible patient, and the orthopedic doctor didn't want to do her other knee. But it was at that point where she really just had to have it done. So she came into the office to get her blood drawn for preoperative on Monday, and I saw her walking down the hall, and she was like a scared child, and her husband was looking at the medicine bottle going, well, I gave her all 3 pills, and it was 15 milligrams of Valium, and she could still walk. I was like, wow. And she just screamed, and she wouldn't get anybody to get her blood, so I said, send her home. I'll see her at lunchtime tomorrow. And they were all like, what are you going to do? I said, well, we're going to do this new thing, hypnosis, with her. And so she came in at lunchtime, and I placed her in trance, asked her to go back to the first time this became too much of a problem for her. She regressed back to a time when she was a small child getting baby shots. And she herself is of color, and she said, there's a black lady laying on me. I can't breathe. I can't breathe. and she was kicking and screaming, and I said, well, what would you like to do with that? And I just kind of watched her for a little bit, and she just grabbed and then threw, and I was like, what did you just do? And she said, I'm going to throw that away. I don't need that anymore. I'm throwing it in the trash. And I thought, well, bully for you, because I didn't hardly knew hypnosis enough. I was just glad she knew what to do. And so I made a very quick, back then we had cassette tapes. I made a very quick cassette tape for her of an induction, a deepening, and a suggestion that she just roll out her arm and have it ready for an IV. And then I wrote a order as soon as she rolls her arm out, sedate her, put an IV and sedate her. And they did that for her surgery. And on Thursday, about 1 o'clock, I get a call, and I'm like, uh-oh, this is going to be a problem. And my secretary said, you got to take this call. I'm like, oh, no. So I get on, and it's actually Mary. And she had her surgery done. And I said, well, how's things going? She goes, good. Guess what they're doing right now? I said, I don't know. They're getting blood. I said, how does it make you feel? She goes, good. And turns out she was diabetic. And from then on, she not just was the first to get her flu shot, she came in and took care of her diabetes and managed it well. And the side story to all that was her, so much of this drove a depression in her. This whole inability to control herself, not just with the needle phobia, but just, phobia in general. She started listening to the cassette tape that I made just for general relaxation and wore it out. But the important part was I found out from her husband he was getting ready to divorce her and decided not to because she turned right around and she was back to her usual bubbly, lively self. So that was it was a great save all the way around, and that was just the first case of many. And we just never know how far-reaching these things can be and how far-reaching problems people have that maybe on the surface one problem, but then there's something else. So that's kind of what got me hooked in, not just seeing it, for myself with my brother, seeing it with patients in medical school, but then, that first case pretty much just solidified it. I was done.
So that's a remarkable story for so many reasons. And if I can ask you a few questions about the story. So, first of all, you knew about hypnosis because you saw your brother in action with it. How long did it take you to get your initial training? You said you took a training course. How many hours did that consist of?
Yeah, so, I obviously had a little bit of it in advance because I had that month with the PhD psychologist, but I just did the 20-hour basic that ASH provides, the American Society of Clinical Hypnosis provides. I think they call it Level 1 now. They've changed the name of it a little bit. But it was just the 20-hour course that was there at the annual. And, I came home on Sunday and I applied that on Tuesday.
So this is remarkable to me that after a 20-hour course, your life as a physician, and I guess you saw what happened to your brother and you had that exposure to your neighbor, but your life as a physician was transformed, and then Mary's life was transformed because of your experience.
Oh, yeah, absolutely. Yeah, it's very life-transforming for both.
And there's a disconnect, isn't there, between what you and I know can happen time and time again with various patients and the fact that medical schools still think hypnosis is either alternative or voodoo or somewhere in the pile of stuff that doesn't work.
Oh, yeah. Well, Ron, that goes into a very, very deep conversation. That goes into how the funding of medical schools take place, how the whole research funding takes place, how the big pharma is in control of the educational process. And, big pharma doesn't want something that works that's free, essentially. You've got to be able to make it into a product and be able to make a sale and profit from it in some way, or a device or a procedure or something of that nature. And so trying to, allow our own mind to come up with good solutions to things and help aid in it it just doesn't fit that parameters, so why learn it? Why teach it?
Exactly, although the patient, of course, is lost in the mix because oftentimes pharma doesn't have the solution, especially if a problem is mostly generated by psychology. In Mary's case, it was, as an example. So you could give her all the pain medications, all the Valium, she's not going to get better without addressing her psychology.
Yes, exactly. And that's also the other point, is the disconnect between the mind and the body. And there should be never any disconnect. The only true disconnection between the mind and the body is the guillotine.
So then another question I have for you. So you said you did an induction. Can you explain a little bit what that is and how quickly it takes place?
Yeah, so in hypnosis terms, when you do an induction, and it really, I've been doing them for over 20 years, and I still don't really understand what an induction is, to be honest with you, because we know that there's this kind of, formal thing that we can do called trance, and we have scripts, and we have ways that we can do it. We can roll eyes and breathe and have all these techniques. But really, I think what it is it's an invitation for that person to make a change and to be hyper-focused on what's at hand. So I think it's more of a natural introduction to a state of mind that we have inherently. Say, for example, you're driving down the interstate and you check out, and you're cars are passing, you're making lane changes. You might even exit, and you don't even remember what you did because you're just your mind's somewhere else. Or maybe you're watching a movie and somebody comes in and sits next to you. You didn't even know they sat next to you because you were so engrossed in the movie. Well, basically those are inductions as well. It's just a hyper-focusing and applying yourself and allowing the person who's guiding you, myself in that case, to guide into solutions for problems or come up with abilities to understand things in different ways.
How often do you spot a patient who's already spontaneously in an hypnotic state? You're having conversation with them, they're paying close attention, and you realize they're in hypnosis. Is that a common event?
Well. So before I learned hypnosis, I wouldn't have understood it. But now that I know hypnosis, every patient that comes to the doctor's office is in hypnosis. Think about this for a minute, Ron. Think about the last time you went to your dentist. Do you remember that visit? Sure.
Not well.
Well, but you remember going, or
yeah.
or like the last time you had a procedure done, or you went somewhere. I mean, you remember these things. They heighten your memory because you're hyped up for it. So people who come in to the doctor are on edge. They're thinking, okay, what is he going to tell me? What kind of thing? Is it going to be good news, bad news? Am I going to, And so most people, I guess, if you ask that question, do you remember your last doctor's office, appointment? Unless you're there all the time, they would be like, sure, and you can, those are times that are stressful for people. And so just by that alone, they're actually in a trance, okay? They're actually hyper-suggestible during that time. And, of course, trauma does that. An interesting story, my next-door neighbor fell out of the tree while he was cutting a branch. His ladder let go. And he came down. I happened to be outside as well. And I heard this crack, and I was like, oh, that's not good. And I looked over, and I saw his ankle was turned sideways. And I'm like, oh, a malleolar fracture, it looks like. And, of course, being a doctor, you see these things. Other people are all freaking out. I'm trying to figure out the diagnosis already. And I came over to him, and his name is Mike. And I said, Mike, very quietly, I think you may have fractured that foot. And then he said, yeah, I think that might be. And he was already in a traumatic trance. So knowing that, I actually helped him in that trance state in order to take care of the discomfort and displace it. I also called 911 for help. So what was really fascinating is he was very, very comfortable, and we were just talking. And when they got there, one of the young EMS, he was like thinking he was, he didn't know he was in trance. and it was fine. He thought he was in shock, started shaking him, and, sir, wake up, you know. And then Mike started screaming. He goes, oh, my ankle's hurting. So, you know, there's a lot of natural trance that takes place, not just in trauma, but also just in that heightened awareness when people come into the doctor's office. So
interesting. I think the reason I don't remember it well is I put myself into trance when not from the doctor. I will go to a calming place when I go to the dentist, and that's where I spend most of my time. So I don't remember it.
Yeah.
But I have the key.
And that's you know, that's the dangerous thing for us, isn't it? You know, I did that too. I've got a dentist appointment on Friday coming up, and the last cleaning I did exactly that. I hardly remember it at all. And that's because the hygienist, you know, is all into it too. He's like, go wherever you want. And I did, and I just, you know, it's always just turn left, turn right, up, down, whatever. And the other thing that's really nice about that with the dentist, though, is, you know, when they're spraying all the water and everything, you can really dry your mouth if you need to for one of the procedures. And, you know, controlling the amount of saliva is so simple. And I used to teach that in the dental residency. So, you know, there's another little quirky thing I didn't tell you about. Or maybe you knew it, but maybe you don't. I spent 25 years in the dental clinic at Caroline's Medical Center teaching the dental residents. These are dentists who leave dental school, and now they come over to the hospital, and they learn hospital dentistry, and they also have and do research, and they do a little much more in-depth dentistry. And some of them will go on and specialize or go on and teach. They may go into oral medicine or go into another specialty within the dentistry world. And I would teach them histories and physicals, and then later I started teaching them basic hypnosis and how they could use it for, you know, not just for pain control, but saliva control and increasing saliva, because we had an entire clinic that we researched Sjogren's disease, which is a disease of dry mouth, dry eyes, and joint pain. And we actually did a research trial on that with hypnosis, which did not show an increase in the amount of saliva, but did decrease the sedimentation rate, which is an inflammation marker. It was too small to publish, so we didn't publish that article. So there's a little quirky one I bet you didn't even know.
Well, you may not remember it. I actually reviewed that article. I tried to help you get it published way back when, so I was going to ask what happened to it.
Maybe. Wow, that's a long time ago.
We've known each other for many years.
That's almost 20 years ago. Yeah. Long enough to forget.
Can you say a quick word about age regression? You mentioned you do that with Mary. What was that about?
Yeah, age regression. I think one of the greatest techniques that we have is age regression. When it comes down to a lot of people's problems, I mean, when we were working in the dental residency with TMJ patients, temporomandibular joint dysfunction, or you know, pain in the jaw joint that doesn't go away. Different medicines and everything else realized that probably the only thing that would work would be hypnosis. And by going back in time, you can find an event typically that took place that seemed to cause a problem. And using this technique of age regression, where you just ask them to continue to go back and back and back until they find where the problem is, then the problem is the solution, and the solution is the problem. It's been a problem for them, and they've come up with something as a solution, which is still acting as a problem for them. Maybe it causes them anxiety or causes whatever. So if you can get back to the root cause, you can then go ahead and fix that.
Excellent. So when we come back, I want to ask you for some marine stories. This is Centerpoint with Dr. Ron Anbar.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, This book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit HealthyLife.net's advertiser page and click on Audiobooks to get started.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services, so much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
HealthyLife.net, where positive overcomes negative.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
More exhilarating talk. HealthyLife.net.
Welcome back to Centerpoint with Dr. Ron Anbar and our special guest, Dr. Joe Zastrow, my good friend who now works with many Marines. And I was wondering if you have an interesting Marine story to share with us.
Oh gosh, I've got so many Marine stories. It's hard to pick which one. Boy, well, let me tell you one that really struck home to me because it really it was a twist in a story I just did not expect at all. And I had a gentleman who was working as a sniper actually, and he was in Iraq, and one of his duties was to take out any of the guys that were suspected to have, vests that were full of explosive devices. And unfortunately, and you've probably seen stories about, the children who ran around with these things as well. And as a sniper, he had to snipe out some of these children, and I thought, wow, this was a very difficult situation. Well, I met him after a surgeon sent him to me. And I thought, well, this is very odd that a surgeon would send me a patient from the emergency room that I had to see the next day. It turns out about 3 or 4 days earlier, he came into the emergency room with the worst headache of his life, he said. And he got an MRI scan, MRA, he had all these tests run. They didn't find anything. They sent him home. The next day, very next night, he came in with the worst chest pain ever in his life. And he thought he was having a heart attack or an aneurysm. They did, another CT scan. They checked him for pulmonary embolus. They, ran all this stuff. Sent him home. The next day, he comes in saying he had the worst abdominal pain of his life. And they couldn't find anything. They called the surgeon. Surgeon came in. Surgeon went back on the chart, fortunately, looked back and was like, you were just in yesterday with the worst chest pain in your life, right? Yep. And then the headache the day before. And he couldn't find anything. And the guy now was glowing from radiation from a CAT scanner. And he said, you know what, I'm going to have you see this friend of mine and go over and see him tomorrow. And then he called me up and said, there's a fellow who really needs your help. He's one of our ex-Marines, and I don't know what's going on, but I want you to take a look at him. And I thought, well, okay. So when I take an intake, Ron, I do it a little bit differently. When I greet the person for the first time, I will say, "Hi, I'm Dr. Zastrow," while I'm shaking their hand, and I will ask them, "What do your friends call you?" And they'll say their name, and then I'll say, whatever their name is back, and they'll say, "May I call you that?" And they'll say yes. And then I will ask them, in this case, like, Ron, tell me about your problem. And then they'll go into their story. And he told me, he said, well, just one day I was at work and it just blew up in my face. And then he went on and started talking about something that was going on with, where he was working. He was working at Lowe's Corporation, upselling refrigerators is what he was doing over the phone. And I went back to him and said, his name's not Ron, but Ron, when did this become a problem? And then he went into a little story and then I said, Ron, what was going on in your life at that time? And I certainly expected it to be something completely related, to the war and such. And I said, it's okay now. You can blow down and be set now. It's okay. And he just looked at me and said, you're the first person to actually listen to me. And using their own words in some way can be very, very powerful. And I thought this was going to be something with an AED, something more to do with war. And it turns out, when I placed him into trance, asked him to go back to when the problem started, it had nothing to do with it at all, even though that was my expectation. That was our surgeon's expectation. That would be the logical expectation. Turns out, he had military benefits and he wanted to go to school and become a nurse. He wanted to be a pediatric nurse. But he had to go to Louisiana to do it. But his wife, who he married because she had children that he adores, he didn't really have that great a marriage with her. It's her kids. He was in a bind. He was in a quandary whether to leave or to stay. And that's what blew up in his face one day. And it was actually a relationship. So I learned that things are not always what they are, that things can be completely different, and you don't even know. He didn't know what they were. I didn't know what they were until we went into trance and then asked the questions. And once we did that, we were able to find what the problem truly was, what blew up in his face. But it turns out he had to make a decision. And about a week later, he came in and he said, thank you so much. I'm headed off to Louisiana. And he went off to become a nurse. So strange.
Very, very interesting.
Yeah. Case.
When I meet patients, I will take a rudimentary history, a little bit, but I don't need to know the whole story because it may not be relevant. And if it's relevant, it'll come up as part of therapy. So it's a little bit different than when I have my doctor hat on and I want to know all the details. I don't know if you do the same.
Yeah, absolutely. Yeah. Yeah, kind of just an interesting, quirks how things go. The biggest ones that we have, of course, right now are Vietnam vets. They're all aging into, the senior years. And as we come into our more senior years, we start reflecting back at what we've done in our life and the things that we've done in our life. And a lot of these guys have been in therapy, and a lot of them have really still haven't come to terms, with what they've done and what they should have done and how they're looked at. And, of course, when they returned from Vietnam back in those days, they were not looked at very well. And then over the years, our veterans have been looked at in a much better light. And so they still have a lot of ambiguity, a lot of disconnects, and a lot of PTSD. And PTSD is, post-traumatic stress disorders. It's with you, and it can be, exceptionally difficult, for couples. Maybe I had the one gentleman a couple of weeks ago I saw because he started swinging at his wife in the middle of the night, and he had been fine for years, but all of a sudden he just started having outbreaks and started beating her up in the middle of the night, and obviously there was a problem, and he didn't know what was going on. When he woke up, he was just aghast. He was like, "Oh my God, we can't be doing this." And he went off in the other bed and wouldn't come back until he knew it was safe. And unfortunately for us, Ron, the VA is just swamped. I mean, they are just working hard. And the good thing about the VA is they've figured out recently that hypnosis is very helpful. And we have seen an upsurge, a huge upsurge in the number of trainees that are working within the VA system. And this is a very good thing. And so I think we're going to see a lot of help for our veterans in the near future from these newly trained people that are learning these techniques.
How open are the veterans to learning hypnosis? Do they think it's a sign of weakness that they need this help, or they accept it?
Universally accepted. They just, I think the young ones, they have absolutely no problem with it. They're like, yeah, that's cool. And the ones that are more in, like, the Vietnam age, they're like, I got nothing to lose, go for it, And I think a lot of it is trust, too. When I'm working specifically with one of my own patients, I already know them. I'm already working with them. They've already had experience with me. Our trust level is much higher. And so it's not like they're coming off the street. They don't even know who I am or what I am or why they were sent there. And that makes a total difference.
So to wind up, I wonder if there was one or two things you wanted the public to know about hypnosis that they might not know already. What would you want them to know? What's the message you want to get out there?
Well, they always think it's for smoking cessation. And for smoking cessation, classic hypnosis, especially in the, when they come into the Holiday Inn type thing, just doesn't work all that well. I think it needs to be individualized because I think smokers smoke for a reason. And once you figure out that reason and use techniques in order to figure that out, they have a much better chance of stopping smoking. And I just think it's something that they should look into a little bit more about if they have problems that they haven't figured out. And if their doctor hasn't figured it out, it may be something that's more psychosomatic and might be very much helped with hypnosis.
Joe, so great to have you. Thank you so much for all you taught us, and I look forward to talking to you for many more years in different form. This is Centerpoint with Dr. Ron Anbar and our special guest, Dr. Joseph Zastrow.
Thank you very much, Ron. It was my pleasure.
Make-A-Wish has been granting life-changing wishes for children and families for over 40 years. A wish is something that gives children the opportunity to look outside their illness and restore a sense of childhood back to the child. With the help of donors and more than 43,000 worldwide volunteers, Make-A-Wish has collectively granted more than 520,000 wishes worldwide. Dr. Anbar has referred many patients to Make-A-Wish. To make a donation, go to worldwish.org. That's worldwish.org.
HealthyLife.net, the positive radio network.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services, so much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
All positive talk with a mature edge. HealthyLife.net.
Welcome back to Centerpoint with Dr. Ron Anbar. It was great to hear Dr. Zastrow's amazing tales, and maybe we can have him back for a future show in a few months. He has plenty of stories to share. Today, though, I wanted to share another one of my patient stories. This is actually a story that's from my book, Changing Children's Lives with Hypnosis, A Journey to the Center, that can be found most easily on Amazon.com, but also at your local booksellers. So it's a story about a boy named Bruce, and I met him when he was 6 years old, and I was seeing him for his asthma in my work as a pulmonologist. But he had many medical issues. He had a history of acid reflux. He had been born prematurely, actually developed brain damage because he had a bleed in the right side of his brain when he was just a couple hours old. And as a result of that bleed and the brain damage, he had a seizure disorder. He had seizures for his whole life. I think at the time I was seeing him, he was having seizures 3 times a month. And what was interesting about those seizures was that they would start on the right side of his head and then spread to the left side of his head. Now, you should know that the speech center is found in our left brain. So when he started having seizures on the right brain, he would tell his mother, I don't feel good, something bad's going to happen. Then the seizure would involve his left side, and then his whole body would convulse. And this persisted even though he was getting lots of different medications. I mean, of course, was interfering with his life. So when I heard this story, I had asked his mother, hey, could I teach Bruce some hypnosis? And my thinking was this. I'd wondered for a while whether hypnosis could help seizure disorder. And the way I thought about it was, well, a seizure involves brain waves acting erratically, and maybe if we can change the way the brain waves work through hypnosis, it would prevent a seizure. That was sort of my hand-wavy explanation for this. And the mother said, sure, you can teach him hypnosis. There's nothing to lose. So I asked Bruce who his favorite cartoon character was, and he said, SpongeBob SquarePants. Now, I personally do not like SpongeBob, but I go with whatever the patient tells me, just like Dr. Zastrow talked about how his patients gave him hints of what to do. So I said, okay, so tell me, what is SpongeBob made out of? And Bruce looks at me and he says, a sponge? Yes, that's right. And what makes him a sponge, I said. He said, well, it has holes in it. Okay, so here's my idea. Every night, put SpongeBob on your head, and when a storm comes, rather than letting it stick around in your head, let it pass through the holes of the sponge. That was an example of 6-year-old hypnosis. So no official trance, no favorite place, going relaxed, just put SpongeBob on your head. And by the way, I did not plan this ahead of time. And one of the things about doing hypnosis with young children is you want to be flexible. Actually, doing hypnosis with anyone is be flexible. In our last segment of the show, I'm going to teach you how you could do that, give you some more examples, how to think on your feet. Anyway, so Bruce started putting his toy SpongeBob on his head every night and tell himself, when a storm comes, I will let it pass through the holes of the sponge. And after a few days, he switched to just an imaginary SpongeBob, and he'd put it on his head and carefully wrap around the string to hold SpongeBob on his head. Sometimes he would wrap it around several times to make sure he got it just right. And told himself, when a storm comes, I will let it go through the holes of the sponge. And since then, he has had no further seizures. It's been now 8 years. I know because just before my book was published, I contacted him and asked if it was okay if I told his story in the book. So, interestingly, his electroencephalogram, his EEG, brainwave study, still shows that he has seizures in the brain. But he no longer feels weird, no longer shakes his whole body. So somehow the hypnosis disconnected the physical seizures with the body movements. How it did that, I don't know. It may be that the seizures he had were what's called pseudo-seizures. Pseudo-seizures are seizures typically where there's no seizures in the brain, but you act like you're having a seizure. Maybe he had both situations, seizure in the brain, and he acted like it, and hypnosis stops pseudo-seizures really easily. Or hypnosis change the way he reacted to the seizures. For example, if you have a pain, like like Mary, Dr. Zastrow's patients who had pain in her hand when she had blood work done, and then she freaked out, she taught herself through the age regression, through hypnosis, to stop paying attention to the pain in the same way. So maybe in Bruce's case, he learned to stop paying attention to the seizures in the way he did, and that stopped the seizures. Either way, he got better. Bottom line, even when you don't know how hypnosis works, it can do some amazing things. And this is why I will offer hypnosis in various situations. Even if I'm not sure it's going to work, I will do it in a playful manner. Hey, you want to give this a whirl, see what this happens. Now, actually, Bruce had two more parts to the story. So he stopped having his seizures, but his mother told me that he has these fevers of unknown origin. He kept having fevers, lasted a few days, every few weeks, and nobody could find a cause for the fevers. I assumed he was having fevers because the brain regulates the body temperature, and since his brain was damaged, maybe the body temperature regulation was amiss. So I said to him, hey, does SpongeBob have a friend? And he says, yeah, it's Patrick. I said, oh, good. I said, tell Patrick when you get hot to turn on the air conditioner. I said, okay. He came back a few weeks later and he said, I've had a few less fevers, but I still get them every now and then. I said, okay. Tell Patrick to keep the air conditioning on always. He said, okay. And the fever stopped, and no more recurrent fevers. So every night he's now telling himself, if a storm comes, let it go through the sponge, and Patrick leave on the air conditioner. So then this boy had quite a bit of ear infections, and he needed antibiotics a lot of the time. And so I said, hey, does SpongeBob have another friend? He said, yes, Squidward. All right. Tell Squidward to spray an anti-bug spray, antibacterial spray in your ear every night. Okay. So every night, if a storm comes, let it pass through the sponge. Patrick, leave the air conditioner on. Squidward, spray this spray. And his ear infection stopped. Now, I don't know if this part is a coincidence. I don't know, but that's the story. And actually, there was a fourth part. So this young man used to trip and fall a lot, and he wouldn't brace himself, so he would fall on his face. And he actually broke a tooth once because he fell on his face. So when the mother told me this, I said, okay, so Bruce, tell SpongeBob to catch you before you fall. That was my instruction, and he stopped falling. And actually, it was a year later, the teacher wrote a note to the mother saying, Bruce tripped today on a hose and actually fell, but he braced himself for the first time. So this young man shows you several things. It shows you that hypnosis can have effects that might be surprising, to stop seizures, to stop ear infections, to control your body temperature regulation, to stop you from falling. Those are things I've not ever been told, or they're not even written up in the medical literature, and yet they work. So giving patients the tool of how to help themselves is a tremendous gift. And of course, when this works, then you don't need medications. You don't need many doctor's visits. This is why hypnosis should be a part of every physician's armamentarium, and of course should be taught in medical schools. And as Dr. Zastrow discussed, the problem is that medical schools are driven by tradition, learned one way, and they only teach the way they learned. They're funded by pharmaceutical companies who want you to do research on drugs that can make lots of money. And a therapy such as hypnosis, which is so simple, helping someone into trance is easy. Helping deepen them is easy. Listening to your patient and helping them find it owned into their story is easy. That falls by the wayside because there's not a lot of money to be made with it. Something to think about and to ponder, how do we change the system? This is Centerpoint with Dr. Ron Anbar.
Heads up, there's a sound and light chamber therapy offered in La Jolla, California at the Center for Holistic Well-Being. Using light and sound frequency produces an energetic vibration that can help restore our body's cellular, biochemical, and neurological balance, as well as help detoxification without harmful side effects. For more info, visit centerforholisticwellbeing.com. Better yet, schedule an appointment. Call 858-215-5489. That's 858-215-5489.
HealthyLife.net, the positive radio network.
Every year since opening Centerpoint Medicine, Dr. Ron Anbar has been overwhelmed with demand for his services. So much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
Uplifting Talk. HealthyLife.net.
Welcome back to Centerpoint with Dr. Ron Anbar. It's been a very interesting day learning about how imagery and characters can help people get healthier. And you can do this if you're a parent. You can do this with your child. If you're good with imagery, you can do this with yourself. You can create your own images with suggestions for the child or for yourself of how to improve. Now, to do this, we're going to talk a little bit about how you might do this. And actually, when you just do an image, it's not even formal hypnosis, and yet it can be very, very effective. So I'm going to give you a number of examples to whet your appetite and encourage you to be creative in figuring out solutions, figuring out metaphors that can work. So basically, you take any character, any figure, anything you might imagine, and then you manipulate it in a way that solves your problem or solves your child's problem. So I remember one young lady who was all of 3 years old had trouble pooping. She was constipated, would sit on the potty and would not go, and this was frustrating to the mother and frustrating to the child because she needed to receive enemas, to have bowel movements. It was a mess. So she's 3. How do you do hypnosis with a 3-year-old? Who was your favorite character? That's a great way to start. And you could do this with your own child. Who do you like? Her favorite character was Daniel Tiger. Now, if you don't know who he is, you have to ask, who's Daniel Tiger? Well, he was one of the puppets from the Mr. Rogers television show, and I didn't know this, but there's a whole cartoon series called Daniel Tiger's Adventures. So, okay, so let me tell you a story about Daniel Tiger, I said to the young lady. Daniel Tiger, guess what? He had a pooping problem. He would sit in the potty and nothing would happen. And then he figured out what to do. First of all, he took some Play-Doh and he played with it when he was sitting on the potty. And I suggested that because I know that when children manipulate things with their hands, it gets their bowels moving. And then Daniel Tiger would say a special phrase whenever he wanted to poop. Now, the girl had told me that her favorite storybook was Go, Dog, Go. I had that information. So I said, Daniel Tiger said, Go, Poop, Go. And then I wrote up this story with her. We actually typed it up on the computer, put some pictures of Daniel Tiger, and I gave it to her. And every day she would sit in the potty and read the story. And within 2 weeks, her problem was solved. How did it work? Imagery. Okay, so that's one example. Another example is having the child take their stuffy or the plushie, and the plushie can talk for them. Or the plushie, for example, you might ask the child who comes crying, and you say, what's wrong? And I don't know. And you say, let me talk to your plushie. Yes. So plushie, can you tell me what's wrong with the child? And sometimes the plushie will be able to tell you. Of course, the child is speaking for the plushie, or sometimes they'll shake the plushie's head or nod it to give answers when they themselves can't give the answer. Now, you may wonder how that works. I think when people move the plushie or the stuffy, whatever they're called in your home, their brain works in a different way. So, like, one part of the brain doesn't know why they might be upset, but another brain can help. In fact, speaking of that, just about a month ago, I started using a new technique that came to pass in my clinic. Let me tell you how I thought of it. So, I read that people who imagine someone else talking to them activate the right side of their brain. Remember, I told you the left side of the brain is where the speech center is. And so when you imagine somebody else talking to you, your left side of the brain is you, and the other person is imagined in the right brain. I also thought to myself that I think a lot of subconscious work takes place in the right brain. Remember, subconscious is a part of the brain that we're not always aware of. And if we were talking from the left brain, it would stand to reason that we're not always aware of what's going on in our right brain, which is, again, where I think the subconscious might lie. So given these two pieces of information, I thought to myself, I wonder if we engaged the right brain by imagining someone talking to us, if we'd get different results. So I had a young man, about 11 years old, who is oppositional and defiant. He says no to everything. Can you please clean your room? No. Can you take a shower? No. Can you take out the trash? No. Everything is a no, and it creates a lot of discord in the family because he's not doing his share. And his siblings start to copy him, which he has 3 younger siblings. So it's not a great situation. So I said to the mother and the child, today, when you go home, I want you to pick one of your stuffies, and this will become your stuffy, your spokesman. And from now on, when your mother wants you to do something, she won't tell you to do it. She'll tell your stuffy to tell you to do it. Got it? Got it. So he went home and picked one of his stuffies, and the mother said to Stuffy, hey, tell the kid to take a shower. She came back next week and they said, 90% better. He's so much more cooperative. Wow. So I did it with another kid who was not cooperative. Again, much better. And so far, it's only been a month. I've taught this to 5 kids, and they all improved. So this might be a new kind of therapy, talk to the stuffy. The one time it didn't work so well is when I had 2 sisters who were fighting each other, and I suggested that they talk to their stuffies and instead of them to each other. And the older sister did just that. She talked to her younger sister stuffy, but the younger sister wasn't cooperative, so that didn't work. So I'm still trying to figure out the whole potential benefit of this kind of approach. By the way, with the first 11-year-old I told you about, who's 90% better, he also knows about the subconscious. He's old enough that we talk about that concept. His subconscious is named George, a name that the boy gave him. And I asked the mother, instead of talking to the boy's stuffy, could you talk to the boy's subconscious, George, and tell George to tell the boy to do his chores? Let me know if it works the same way. And indeed it did. So George also has the same effect as a stuffy, which I think illustrates perhaps that the stuffy activates the subconscious, perhaps. And then another problem came up because my patient's younger siblings made fun of the fact his mother was talking to Stuffy and to George, and he didn't like that. So at his last appointment, I suggested the mother write a note and give it to the kid to show George. I don't know yet whether that worked because I haven't seen him back. This is cutting-edge hypnotherapy I'm describing to you. Maybe later this year I'll let you know what happened with this particular approach. So again, the principle is take something that is meaningful to the child, a favorite character, favorite stuffy, tell them a story, and this can help change their lives. A quick story, my youngest underwent heart surgery when he was 3 and was very scared of the bandages coming off. So I told him the story of the 3 little pigs, and when the wolf helped him puff, the bandages came off, and he didn't even notice them because he was so entranced with the story. Many uses of stories. We'll talk more about stories in the future. Thank you so much for joining us for this show this week. I look forward to seeing you next week. This is Centerpoint with Dr. Ron Anbar.